Hi, this is Dr. Ian Pinto. I'm a cancer and a blood specialist. I've trained in the US for the last 15 years, trained in practice at centers such as Memorial Sloan Kettering Cancer Center, NYU, State University of New York, and I moved back 4 years ago, currently working at hospitals like Breach Candy, Jaslok, Saifee in Mumbai. And today we're going to talk about cancer. What exactly is it? Can it be prevented, and how can it be treated? I'm working with the Indian Cancer Society on getting this message out to you. So let's first start with what is cancer. That's the number one thing, right? If you know what is cancer, you'll fear it less. Cancer is a change in a cell. It mutates and it starts producing much faster than the surrounding tissue. So you get a lump or a growth or a bump, and that's normally how cancer presents to most people. What causes cancer? One of the biggest problems I've seen with all my patients is no one wants to say they're diagnosed with cancer. And the biggest reason for that is if I tell someone I have cancer, maybe my daughter won't get married, maybe my son will not get married, they say cancer's in the family. But if you can see genetic causes of cancer, that's just 4% of cancer. Okay? The largest percent of cancer is tobacco. Almost 40% of cancer is caused with tobacco and tobacco-related products like gutka, pan masala. So you can clearly see that causes the largest chunk of cancer, and this is a preventable cause of cancer, something that we can prevent very easily. Obesity causes and lifestyle factors, 15%. Easy to order your food, use Swiggy, use Scootsie online, right? The food is at your doorstep. You don't even have to go to a restaurant to get stuff. You've got Domino's, Burger King, all these burgers and pizza chains. Easy access to really bad calories, right? And are you walking these days? Probably not. Why? Because you're Ubering it or Olaing it, right? So you're always using cabs, and of course we have no roads to walk on. 10% of cancer is related to infectious diseases like human papillomavirus. I'm going to talk about that a little bit later. Hepatitis B and C. And those are something that we can work on preventing. Diet and poor preservation of food, that means we're not storing our food adequately, that actually has gone down because we have better refrigeration now. 25% of cancer, we still don't know what causes it. We're working on researching, but the main point from this slide, 40% tobacco related. Today, the talk is mostly focused on breast cancer. It's the #1 cause of cancer in Indian women in all cities, and also the #1 cause of cancer deaths in Indian women. So breast cancer, as you can see, is increasing, and it's causing a problem in most of our cities. Now, when we have a cancer, I told you cancer is a change that cells are producing really fast. We try to see where the cancer has started. For example, if it's a breast cancer, it starts in the breast, and then we look for, has it gone to any distant organ, maybe the lung, the liver, or the bones. If it has gone to a distant organ, it's likely a later stage cancer. Stages go from 1 to 4, 4 being the worst, which is a spread cancer. Now, we look at on the right side here, this is the US data for cancer diagnosis. Most cancers being diagnosed in stage 1, that's early stage cancer, okay? Well, here are the top 4 centers for cancer registries in India. Most of the cancers are diagnosed in stage 2 and 3. So we are seeing a larger proportion of our cases diagnosed late. So the question is, all right, the US is diagnosing it earlier. Does it make any difference to have a cancer earlier or late? And when we look at data for survival, the 5-year survival for an early cancer is almost 100%. And that drops down to almost 25%, if it's a late stage cancer. So it's a huge difference from being diagnosed early versus being diagnosed late. How do we pick cancer early? The only known screening method for breast cancer prevention is actually a mammogram. The goal of screening is to accurately identify asymptomatic disease. That means women do not have any disease, and we're trying to find the cancer in them without them having any symptoms of the disease. So we can find it at an early stage and hence improve survival. Okay? When anyone hears the word mammogram, some women often say it's painful or hurtful, but most women who have gone and experienced it at a good center normally do not have these symptoms from it. So it's a very well tolerated, easy test. A lot of misconception around the test. Another fear factor is radiation. There's really minimal radiation, and the survival. You're improving your cancer-related survival by around 20% by this test. So minimal radiation, a lot of positives. We have the older methods. That's the most common method is something called a film mammography, where they do just an X-ray of the breast. We also have digital acquisition of those pictures, called a digital mammogram. And now we can actually reconstruct it on a 3D reconstruction to have a better understanding of smaller, lesions out there. Now, when should we get a mammogram? When should we start screening women for breast cancer? Here are guidelines from across most of the developed countries. On an average, at the age 40 to 45, for women, every 2 to 3 years, all the way up to 74 years of age. I repeat, 40 to 45 years of age, every 2 to 3 years, all the way to 74 years of age. Every woman has around a 15% chance of having breast cancer. There's a 15% breast cancer risk. A small percentage of women, around 5%, 4 to 5%, have an increased risk for breast cancer by having a genetic mutation called BRCA1 or 2. It's called a BRCA mutation or a BRCA mutation. Now, when I say that, it sounds funny, but everybody's heard about Angelina Jolie, right? The actress, right? So Angelina Jolie had both her breasts removed, right? And the reason she removed her breasts was because she had a BRCA mutation. So who has an increased risk of having this gene mutations? If the breast cancer is diagnosed really early, that's less than 50 years of age. If it is in sequential generations, grandmother, mother, and child, that increases your risk for breast cancer being genetically related. All patients with ovarian cancer should get a BRCA mutation testing done. Triple negative breast cancer less than 60 years of age. That means if you have no receptors positive, triple negative breast cancer should get a BRCA mutation. Now this BRCA mutation, if positive, has implications not just for women, but also for men, okay, in the family. So it's not just the women. Men can also get breast cancer. And men, if they get breast cancer, are more likely to have this BRCA mutation. So this is not just for women, also for men. Other risk factors to increase is oral contraceptive pills or hormonal therapies that have estrogen in it can increase your risk for breast cancer. And alcohol. Women are drinking a little bit more than they used to, especially in India, and also smoking more. And alcohol can increase your risk for breast cancer too. What decreases it then? So some of the good news, breastfeeding. A lot of people have been decreasing the amount of how many months they actually breastfeed their kids, and some just don't breastfeed. But breastfeeding is actually protective against breast cancer, and we must encourage it. Having children actually decreases your risk for breast cancer, and having a healthy diet and a fit and ideal weight actually decreases your risk for breast cancer. For your time and attention, my name is Dr. Ian Pinto. That's my clinic in Bombay, in Kemp's Corner. My number is 7045-348-071. I have my email address on the screen. Again, thank you for your time and attention, and thank you to ICS for helping us with sending this message out.